ROPAC stands for Registry of Pregnancy and Cardiac Disease, and it's a study that I initiated 10 years ago together with Professor Roger Hall from the UK, and we both had the same idea at the same time, and that is that women with cardiac disease who want to become pregnant, we're not sure what the risks are. And for some women it's probably too high risk, and for other women it's completely safe. And doctors are struggling with that, and there's no data, absolutely no data, because it is so difficult to perform a randomized controlled trial when a woman is pregnant. So therefore we started the ROPAC, which is a worldwide registry under the umbrella of the ESC, Europe, the European Observational Research Program. And we enrolled 5,739 pregnancies in women with cardiac disease. So I think that's an amazing number. So finally, by putting all these women together, we get better numbers and can provide much better information to our patients. Well, we present the 10 years outcome, and first of all, the most important number is the maternal mortality in women with cardiac disease, and the overall maternal mortality is 0.6%. And that is 100 times higher than the expected rates in the normal pregnant women. So that is quite high. However, at the same time, I want to stress that we also identified many women who have low risk and they can go through pregnancy, and we should reassure them because now sometimes doctors are too protective for their patients, and of course for a woman it is very important to have a baby. For instance, I just had a patient 2 weeks ago, and she came in with her daughter, and she came in to thank me because her whole life she had been told that she could not become pregnant, until I said, well, you can, and you should. And well, of course it was quite a shock for her if you have heard it for all your life, and now she came in with a healthy baby, so that is really fantastic. So the main complication was heart failure. It occurred in about 11% of patients. Arrhythmias were found up to 4% of women. The highest risk group was pulmonary arterial hypertension, and there the maternal mortality rate was 9%. So these are the women that really should be advised not to become pregnant. And we also looked into the developments over time, and what we found is after an initial increase in maternal mortality, after 2010 we finally saw a decline in maternal mortality. And of course we're looking for reasons why that is, and probably maybe it's also that there is a role for the first ESC guidelines on pregnancy and cardiovascular disease, because they were published in 2011, and more awareness for this problem. And I think by having a better pre-pregnancy consultation for the patients and counseling of the risks, we can better advise them, and hopefully they will listen to the doctors, and therefore I think we can bring down maternal mortality finally. Well, in this registry we identified some specific topics of interest, and I think now is the time to also start randomized controlled trials in pregnant women. And for instance, the use of beta blockers, we know that it's useful for the mother, but we also know it has effects on the baby. For instance, the birth weight is lower, and you can have more diabetes in the baby. So I think now maybe we should start a randomized controlled trial on beta blockers during pregnancy. And we also identified some very other important topics. Medication is very, very difficult during pregnancy, but if it is necessary, you really should give it. So that's, I think, also an important message. So finally, the ROPAC has now finished, but we will continue in 2 subtopics, and that is women with a mechanical valve and women with a dilated aorta. So these are 2 new sub-studies starting now. So everybody who is willing to participate in these studies, they doesn't have to be specialized cardiologists, but everybody with an interest in this field is very welcome to join us.